So our moderator for this session is Saschveen Singh. Saschveen is the Tropical Infectious Diseases Advisor for MSF France. She is a Master's in Public Health and Tropical Medicine, and a background in general practice, pediatric and adult emergency medicine. Saschveen is co-lead of MSF's intersectional malaria vaccines group. And when not working on malaria, she is OCP's neglected tropical diseases advisor and on the OCP's epidemics team. Over to you, Saschveen.
Thanks so much, Joanna. And hello and welcome to everybody to the Paediatric Days 2022 session focusing on malaria. I'm very honoured to be asked to help moderate this session. So this session really aims to underline that prevention is better than a cure. So while acknowledging that prevention implementations can sometimes seem more challenging than providing well-known treatment options, over the course of this session, we're going to actually steer the discussion around the debate about these implementation challenges and really focus our attention on some quite efficient implementation strategies that will be able to consider the contextual and some of the seasonal variations that we see across MSF settings and different project locations. So we will provide some quite concrete field-based examples of vector control, intermittent preventive therapy in infants, or as it's known now as perennial malaria chemo prevention, and also SMC, which we've just heard about earlier in the day. So why do we need to be having this conversation today? The most recent WHO malaria report showed us from 2021 that there were actually 241 million cases of malaria that were recorded in 2020, and of which 627,000 were fatal. 95% of these cases and 96% of all deaths, sadly, were in the African region, and about 80% were actually in kids under 5. And four countries actually account for the majority of the deaths. And you can see on the slide here, Nigeria, DRC, Tanzania, and Mozambique. They're all places where MSF have a presence. And you can see from this graph that the trends in absolute numbers of malaria cases, but as well as deaths, have seemed to be plateauing over the last years. And despite current tools that we have for prevention, some high burden countries are actually even seeing an increase. 32 countries showed an increased case incidence, and 17 countries had an increase of 40% or more. That was just in 2020 when we compared to 2015 levels. The reasons behind this are a bit complex. So in sub-Saharan Africa, more and more people are living in malaria risk areas. Malaria funding has also been plateauing, sadly, and essential vector control interventions have been flattening in some places. So for many people living in risk areas, they also have trouble accessing emergency and primary health care. It's just not adequate. So we need to do something about this. Now, the use of long-lasting insecticide nets are already embedded in MSF interventions and has the potential to reduce malaria cases by 50% if they're properly distributed and used. But the distribution of nets just cannot happen in a vacuum. It has to be part of a broader package of malaria interventions. Strategies such as the implementation of IPTI, or SMC, IPTI can be massively impactful. And actually there's studies looking at IPTI, or intermittent preventive therapy in infants, using a drug called SP, or Fansidar, has shown to significantly reduce clinical malaria and the incidence of anemia in the first year of life, as well as hospital admissions with malaria infection and related to any cause. And recent studies have led to the WHO extending their guideline on IPTI recently to include children up to the age of 2 years. And this has triggered a name change. So this is now called PMC, or perennial malaria chemo prevention. And if we can widely adopt this and implement in recommended areas, it could prevent about 6 million cases of malaria and save tens of thousands of lives. Now, of course, there are new things on the horizon. Vaccines we'll hear about a bit later, which will be an important addition to our toolbox. But actually, our existing tools are not adequately implemented. So we have vector control interventions, we have chemo preventive drugs, we have rapid tests and essential treatments. And in the near future, we will be adding vaccines. But right now, at the global level, malaria control is at a crossroads. So these tools, as I mentioned, are not adequately implemented. So despite gains since 2000 on some indicators, we know that bed nets are not adequately protecting, because we've seen a decline in many places since 2017. We're also seeing less populations who are covered by the protection of indoor residual spraying. We know that not enough pregnant women are getting the Fansidar in the second and third trimester, and clearly this is having impacts on the neonates. And we're also seeing challenges with just the general planning and logistics and implementation of SMC. And if we add to this other threats, then it's really important that we take advantage of this additional impact. Additional focus on malaria in recent years. The WHO had a World Malaria Day this year, and I thought it was interesting to share with you that the theme this year was harness innovation and reduce the malaria disease burden and save lives. And this is a really timely reminder to us that we need to really strengthen all of our interventions. We need to be creative and we need to be proactive in order to tailor our interventions to the local needs. No single tool is going to be able to control malaria alone. Now, let's zoom in to MSF activities. So in MSF, in 2021, we treated 2,681,464 cases, which is enormous. And we've managed malaria campaigns for prevention in very diverse settings, such as Venezuela, Nigeria, Burundi, and Guinea. Sadly, in 2021, just two countries, the DRC and CAR, accounted for more than 50% of all cases of malaria that were treated by MSF. And these are the areas that have had very limited chemo prevention options in the past. But today we're going to hear from MSF teams who are doing some innovative work in those countries to address this. MSF has always been at the forefront of pushing delivery of malaria interventions to those in need. This ranged from implementing RDTs early on, making the switch to artesunate and ACTs, and also the piloting some of the biggest early pilots in SMC in West Africa just a decade ago. And as I mentioned previously, this renewed attention to malaria recently gives us the opportunity to engage more strongly on prevention. MSF have committed to harnessing this momentum in order to improve malaria implementation overall.